What's up guys, Coach Nathan Barbosa here with PhysioFix Training Systems. We're going to continue the neck release series and we are going to be looking at the scalene muscles today. We're going to be looking at anterior, middle, scalene primarily. So these cause a lot of issues for a lot of people. The muscles tend to elevate the first rib. So basically it gets so tight it pulls everything up. When it pulls things up, it compresses your blood flow and your nerves that run around the collarbone and into the arms. So if you're somebody who gets numbness in your arms when you reach overhead, maybe even when you reach out, some people even just getting to about here causes tingles in the fingers. So if this sounds like you at all, I highly recommend you follow me through this video to learn how to release this tissue. So I typically use my fingers on this. I find it works better. If you don't trust your touch, maybe you have long fingernails. For ladies, really I'm talking to you guys here. These little guys here work great. This is just a golf ball. This is a rad trigger point ball. These are unique, most people don't have these. So golf ball works fine. Lacrosse ball is really great when you're learning this because you don't have to get so specific. You can just kind of shove it on there and start working that tissue and it works well. So this one's gonna be pretty straightforward. I'm not gonna get super specific here. I'm just gonna tell you guys what to feel for and what not to feel for. So first things first, anterior scalenes are gonna be kind of here in the front. So if you feel, you got your sternal notch right here, kind of the base of the throat. If you move your fingers around side to side, you feel the ends of your collarbones. So find the end of a collarbone and then go over that end and then kind of swim your way into your neck. So usually what you feel is these vertical strings that feel pretty tight. If you lean your head side to side, we're not twisting, you're just rocking side to side. When you rock away from it and they get really tight, that is your anterior scalene or your front scalene, whatever you want to call it. So from here, similar to how we did the SCM muscle, we're gonna slack that muscle. So we're gonna lean into it and very gently turn down. And then you're just gonna do a little cross fiber action here. So those fibers literally go up and down. So you're gonna go side to side on those fibers. Give them a little stimulation. After you've done cross fiber for about 5 to 15 seconds, whatever feels good, then you're gonna push into that tissue and you're going to not slide your fingers up, you're just going to push into the muscle and then drag the skin up with it. Literally like you're pushing the muscle in the direction you want it to go. So we'll be here. I want you to literally push into the meat of the muscle as you lean away from it to tell the tissue where you want it to slide, where you want it to go. If you feel your heartbeat, you're on the wrong thing. If you get tingles somewhere, you're on a nerve. If it just is downright straight up painful, either A, try a different spot, or B, stop trying to do this yourself and go find a professional who can do it for you. So this is just a recommendation for at-home release. I'm not advising anybody beat this stuff up yourself, but if you would like to learn how to, this is a good place to start. So that's your anterior scalene. You'll do this on both sides. Go through this at whatever intensity you are comfortable working with. You're not just going to work low though. I want you guys to try to follow that tissue up a little bit higher and see if you can find some cool little spots that might talk to you. Do this on both sides a couple times a day. If you have any questions, let me know, and thanks for watching.